I would like to acknowledge the role of my wife, who is a therapist, in making this talk. All of us sitting here have had experience back or neck pain at least once in our life span. Fortunately, most have got better with just physiotherapy, some painkillers, activity modification. But today in this room, there are at least 10 to 12 people who, if they have not already had, will require a spine surgery in their lifetime. For a nation of 1.35 billion, that's a very frightening statistics. So what is this all about? Why back pain? Where are we getting it from? This is a very familiar sight we see in our offices. This is how most of us end up working. And the reason is, sitting is actually a very new thing for humankind. It is something that has become very common only in the past 50 years. At least my father had a job in the manufacturing economy. Most of my friends are in the service economy, so they have sitting jobs, while our previous generations would do most of their work walking and standing. Well, that's the reason we have this epidemic of back and neck pain. One of the ideal things to do is every 45 minutes that you're sitting, they say it's you should be walking for 15 minutes if you don't want to experience some back pain. And of course, for happy sitting, the ergonomic posture, as they say, is a firmly supported back. Hips, knees, and ankles at 90 or 100 degrees with a screen that is at the level of your eyebrow so that you're not looking up or looking down, and elbows resting on the side. That makes for happy sitting because everybody knows that bending forward and lifting weight loads our back abnormally, but what we tend to ignore is that sitting and bending forward is probably more toxic on your back than the rest of it is. Well, neck pain. I would like a show of hands here. How many of you have gone out and played on a football field, a game of football or cricket? Okay, there's a fair show of hands. Now, how many of you see your children play the same game on a PlayStation or a Wii? So, that's what is happening. Unfortunately, like weight by displacement, the further you go away from the center of anchorage, the stress on the liver arm goes high. This is a very frightening thing, and most of us are here by the end of the day. And that's the reason there's an epidemic of kyphotic necks and discs that have herniated out. So what is an ideal posture? They used to say a chest out, stomach in, and standing straight. An ideal posture in a branch of posturology, as they say, is when your ear, your shoulder, your hip, and ankle is aligned in a straight line. That's when you're holding a posture that is normal. Well, what changes it? A lot of things: obesity, poor musculature, sitting, sloth, one of the most common reasons, stress, pregnancy, inappropriate footwear. These all contribute to a poor posture. In men, this is the classification. All of you need to decide in which part of this picture do you stand. And the women need to sort themselves out in this. So there is an ideal posture. I have borrowed this slide from my physiotherapy friends, where the physiotherapists have classified an ideal posture and the variants. We need to sort ourselves first so that we are able to sort our patients accordingly. What does it do? As surgeons, we want to know what happens at the musculoskeletal level. That's what happens when you have a poor posture. Especially when the neck is slouched forward, as most surgeons would be, you have a problem with not just the neck support, but also with your shoulder complex. So you need to be careful with your neck. Ideal standing, weight carrying, and working posture should be maintained. You should try to extend it to sleeping in a correct position. Try not to twist yourself. I personally believe that in sleep, you tend to correct yourself to your best position. But then physiotherapists have a different take on this. So sleep properly. Childcare, I think Dr. Ram was going to talk about that, but we'll leave it for that. But we had children who were very thin, and fat people like me were called pharynx babies. Today, there are very rare thin babies, and everybody is a pharynx baby. So childcare is a very important thing. It's better to be careful while handling children, grandchildren, so that you don't end up being back patients. It's about working smarter, not harder. All of us have been stuck at home and doing all our domestic chores, so it's just smartening up your work, using long lever handles for sweeping, mopping. This is something I've done for 1.5 years, and man, it was tough. But yes, smart liftings, avoiding unsafe lifts, doing it properly, building up teamwork helps. And like Abhay said, what has happened, we can't change, but we can definitely change where we are going to be by taking safety lessons in ergonomics. Thank you.